As we know, International Men's Day was on Tuesday, and the member for Leighton and Wanstead talked about his service and the horrors of war. Tuesday was also 1,000 days since the Russian invasion of Ukraine, and I want to put on record my thanks to all of those men who are serving on the front line in Ukraine today and who have been injured or lost their lives in that awful conflict. Many important issues around men have been raised today, and I'm in agreement with much of the sentiment of the debate, particularly on issues of health and of the dangers of social media platforms. But this debate should be inclusive of all men, and I want to affirm that trans men are men. So I'd like to commemorate the Transgender Day of Remembrance, which was yesterday, and this day is an opportunity for us to honour those murdered as a result of transphobia, and the many more who have died by suicide. This includes many trans men, and the issues I've heard debated today, including mental health and suicides, are experienced by trans men. Men and boys face incessant pressures to live up to myths and stereotypes about what masculinity and being a man is. There is a fracture between the images we see in films and television of what being a man looks like and the qualities that we promote and value in our male role models. As we know, this gap is dangerous. It has made men vulnerable to increased mental health problems and death by suicide. It's debates like this one today that help us to understand the range of experiences and differences of men across the world. So I thank everyone for being here and for their honesty. I want to use this opportunity to talk about the unique issues trans men and trans masculine people face in the UK. I'm not an expert by any means, but I do know that addressing the significant marginalisation of trans men and trans masculine people benefits everybody. I want to thank all those who have educated me and continue to do so. Transactional, for example, have been doing fantastic advocacy work in Parliament, with a drop-in just last week. Trans and masculine people have historically and continue to face erasure and lack of representation in society. They are largely invisible in the media, on TV and in films, whereas we see a hyperfixation on trans women in certain parts of the media. As a result, there is a big gap in understanding the material issues that trans masculine people face. It means that access to healthcare is poor. They face an increased risk of abuse, including domestic violence and, of course, transphobia. In the world of sport, for example, gender-critical feminists are expressing high levels of concern at the possibility of including trans women. They are fighting for the same exclusion of trans women across other sex-segregated spaces, but there's silence surrounding the experience of trans men in these same conversations. This erasure leads to dangerous myths developing about the experience of trans men and a reluctance for people to try and access support or feel part of the community. Trans actually told me that generally trans men are less likely to respond to surveys, despite the most recent census revealing there are largely equal numbers of trans men and women in the UK. We must really listen to trans men and trans masculine people's needs and feelings to even begin to improve well-being and liberation. Trans men and trans masculine people face a number of barriers in accessing equal quality healthcare on the NHS. Waiting lists to receive top surgery on the NHS are now in excess of 4 to 5 years just for a consultation in England, and waiting lists are growing. This leaves a situation where trans men and trans masculine individuals are forced to pay for private care, which not everyone can do, as we know, or to put up with dysphoria and the other associated mental health impacts, which there is a lack of sector-wide support and training. Top surgery drastically improves well-being and saves lives. It isn't something nice to have for trans masculine people. Across the NHS, there needs to be a great awareness of trans men and trans masculine people who have given birth. If, for example, a trans man is not asked whether he could be pregnant before receiving a dose of radiation, there could be serious consequences. We can begin by removing gendered vocabulary from pregnancy care and parenthood. There are cases, for example, the well-known situation of Freddie McConnell, where he was unable to be listed as his child's father. The High Court ruled that even though he was considered a man by law and had a gender recognition certificate to prove it, he could not appear on his child's birth certificate as father or even parent. The same problems occur in access to cervical cancer treatment. Currently, a trans man or non-binary person with a male sex marker on their NHS record will not be included in the recall system. In this area, the law is all over the place and needs to be more input from trans people themselves. By moving to greater awareness, we can significantly improve health outcomes for all men. Male privilege, patriarchy, is bad for men. By speaking out about the varied experiences of men, we will all become more liberated. Gender diversity is a gift. To truly expand how society understands masculinity, we must bring together everybody's experiences. Thank you.
Lola McAvoy.